Good evening, Imagine Families. We are sending this out tonight to just give you an update on our learning environment and reopening plan. We have made significant changes. We know you're waiting to hear from us. So we're going to spend 5 or 10 minutes tonight going through everything to give you that update so you can start to plan around what school is going to look like. Before I get going, I do want to just reiterate what I was able to say in the listening sessions for those of that you were there, and just remind everyone that we are, a community together as a school. And even though we might have different opinions about what should happen with school, we do have a shared goal, which is making sure our students are getting the best education they can, and that all of our stakeholders in school community are able to be safe and healthy while that's happening. We do hope that you can share in that spirit of school community with us, and that we can take care of each other and remember each other throughout this, and then come together and start to pick up the pieces once this crisis is over, as we start to put our lives back together. So we just really want to share that with you and hope that you share in that spirit of community with us as we move forward during COVID-19. Tonight, as I go through this, you're going to hear a few things from me. I am going to go over that stakeholder input. I'll talk through current COVID-19 data, talk about enrollment data, staffing concerns, and then I'll get to that reopening update for you. So our goal, as we got our stakeholder input in the listening sessions, was just to make sure that we really heard from the perspective of all of our stakeholders. And we this time did the listening sessions because we really wanted to hear sort of in an authentic way how everybody was feeling, and it was a really great process. We felt good about. I also just want to remind everyone that we are a publicly funded school. The federal and state government gave us about $13 million this year for school, and that $13 million is to be used to provide education for our 1,230 students. Of that $13 million, we spend about 80% of that on our staff, teachers, that's true across all school systems. And so I just think that really highlights what an important stakeholder our teachers are and how valuable they are as a resource to all of us, you and us as a school. And obviously their perspective is very important as we listen to stakeholder input. So here's just a quick overview of our listening sessions. There were a total of 6, and you can see the numbers here, but for sum total, we heard from 577 folks. We had 577 attendees, some of whom spoke, and additionally received 37 emails answering the questions that we asked. So we feel really good about the number of people we heard from, and again, it was really actually great to sit in those sessions and hear from everyone. We enjoyed it. So I'm going to go through all the concerns. We asked 3 questions in each session. 2 of those 3 questions were the same across all sessions. And so one of those that was the same across all sessions was talking about returning to in-person instruction. So in all 6 sessions, we heard these concerns: current infection spike, bringing the virus home, considering vaccines in our planning, and student and teacher mental health concerns. During our faculty sessions, we had a few more that were highlighted that we thought were really important. Teachers really wanted to share that they had to get close to teach effectively, that there was quite a bit of violating physical distance in several instances. They really felt unable to meet the needs of both groups in a hybrid scenario. When have kids in front of you and kids at home, it's just been very, very taxing for them. And they do feel right now that all stakeholder input is not valued equally. So then when we asked about concerns to returning to 100% virtual instruction, again, across all sessions, this is stuff we heard: student mental health, loss of social interaction, and providing families and teachers a choice in what plan they're participating in rather than forcing them to be in that virtual plan. That same question, just from our faculty, these are the 3 big themes we heard: student mental health, education, instructional gaps, and that our teachers really want to be able to work from home so that they can be safe right now. With our family and student sessions, these are the themes we heard. We heard that student engagement was improved in the building, that children really, really want to be at school. They feel like there's equity issues, that there are students who are lost virtually. People are very concerned about excessive screen time, that grades are declining, and people are very worried about long-term impacts on GPA as well. Our third question was different for our faculty than it was for our families. So the faculty question asked which plan we should follow, and this is a summary of the answers we received. I do want to point out we have 34 answers here and 137 employees. So a reminder, what you see here is not, we didn't get an answer from every employee. Those are just those that chose to share with us. We did hear a lot from our faculty and some families that we create some clear metrics to use as part of our plan. And we felt like that was important to highlight here as well. Our third question in our family and student session was, what is one thing you want us to think about or consider as we make this decision? And so we got so many different answers, we pulled those themes out here for you. But they are to make the commitment to virtual for a shorter amount of time. That if we stay virtual, consider providing small one-on-one person opportunities for students that are struggling. Consider changing class length in middle and upper school and reducing changing deadlines and workload. Provide more social opportunities. We heard a lot about trying to understand how daycares and private schools are open and have been open. That masks and social distancing do work, and they know that we have those in place in our school. People really felt like school's the safest place for children to be. And we did hear quite a bit about how 100% in-person instruction would be the most effective for students. So I'm going to switch gears now and just talk through the current COVID data for you. We did go ahead and update the dashboard. We usually do that only on Tuesday, but since we were presenting today, we felt like we'd go ahead and show you a snapshot of where we are today. The current test rate in Buncombe County is 11.4%. That does put us up in that highest risk category. Our cases per 100,000 over 14 days are currently 801, again putting us in that highest risk category. And then the implementation of the 4 strategies, this is something we utilized when we had the kids in. We actually surveyed our staff every week, and we scored at a 4 consistently in the hybrid model, and it was the social distancing that was the one that we weren't able to get that point for. Right now, 1.5% of our staff are positive cases for COVID-19, and 3.6% of our staff is currently quarantined related to COVID-19. I am going to take just a minute and I'm going to go ahead and click this link and come back over to these CDC metrics. We've been using them for quite a while, but just to let everyone see what these metrics look like. I'm not going to completely go through them, but just sort of let you see. So when we look at those cases per 100,000, to be in the lowest risk, we'd want to see less than 5. And then when we get over 200, we're in the red. And so remember, we were at 801 right now, so considerably over that 200. And then the test rate, in order to be in that lowest risk category, we want to be less than 3%. And then when we get over 10%, that's when we're in the highest risk category. And again, we are at 11.5%. And then here's the implementation of those 5 strategies. They're listed here again. Consistent and correct use of masks, social distancing, hand hygiene, cleaning, and contact tracing. And you're in that lowest risk when you can implement all 5, and the highest risk when none of those things are happening. So I think those are important to see again as we talk through this. The other thing we want to talk through with you is the current North Carolina vaccine plan. This link's available. The presentation's available to you too, so you can get to these links. I encourage you to click it later and read. There's a lot of more information here, but this is the 4th sort of reiteration of the vaccine plan coming from North Carolina due to the fact that I think they keep getting new guidelines from the federal government. So it changed today. Previously, older adults were defined as 75 and older, and today those older adults were defined as 65 and older. And you can see that those 2 groups are currently active, so that changed today. And then our third group coming out of here will be frontline and essential workers. That does include anybody that works in a school building is considered a frontline worker. So we will be the next active group coming, and don't know what this change means for timing. I just wanted to have a look at this with you all and make sure that you are seeing the most updated information. So next is just sort of to see our withdrawal data across the year. We have 3 years worth of data here for you. So typically in a year we have about a 5% withdrawal rate. And we do replace these students. We have a significant wait list. And this year we've had a 12% withdrawal rate. Again, we have a significant wait list, so the students have been replaced, but it's definitely data that we've been looking at as we make this decision. I don't think this data looks different than other schools do. Enrollment has been an issue discussed across school leader calls over the course of COVID, in my experience. This is a snapshot of staffing concerns. We have a lot of staffing data. We thought just showing you the last 2 weeks would help paint a picture for everyone, just to make sure we're clear and you understand. Prior to COVID, we had 20 substitutes on staff available to call at any time, and that is down to 6 during COVID. So right now, I have 6 substitutes to call to if I have a teacher that can't be at school. And just because I have 6 doesn't mean they'll always come. So we typically can consider that about half of our substitutes will answer a call on any given day, meaning on a given day I probably have 3 available to me. So we try to take the number of staff that have been out over the course of the last 2 weeks and just sort of show you where we feel like, oh no, we wouldn't have been able to operate school safely. We wouldn't have substitutes to stand in place to make sure that we're with the children, and you'll see lots of red on there. So we just want to make sure we highlighted that. There is financial strain on the school related to paying out extra leave and paying substitutes, which our finance committee has talked through quite a bit. We also just kind of, as we talk through these staffing concerns, want to reiterate that the number of quarantines for faculty, while there's significant community spread, really we feel like aren't allowing us to safely operate school for in-person instruction. Now, I just want to take a second and talk to you about current state guidance. So based on the information we've gotten from the Buncombe County Health Department and North Carolina COVID-19 updates, we don't anticipate the current data trends reversing. We do anticipate that things will continue to increase, or that we might see a plateau based on conversations with the Buncombe County Health Department. The governor reiterated this week that his office does not plan to change the guidance given to schools, and per the current state guidelines, K through 5 schools may choose to may choose to operate under Plan A, B, or C, and 6 through 12 schools can only operate under Plan B or C. I just want to take a moment and remind you all again that we're a public school. Those are not optional guidelines for us. We must follow them. So just to remind you of that current climate. And now I can get to our reopening plan update. So we have created metrics to determine what learning environment the school is going to operate within. I will get to them in just a moment. The metrics we've selected come from those indicators that I just went over a minute ago. The only thing that's not on there are vaccines. We decided to take vaccines into account, and as I've told you and just shared a moment ago, that plan continues to change. And so as these indicators and the vaccine plan changes, it could cause us to change our metrics that we've laid out here for you below. And so we just want to remind you how often these guidelines change and how that might cause us to change. The 5 key mitigation strategies are referenced there again for you. We are using this color coding on our metrics plan that aligns with what you saw on the CDC. Again, these things are subject to change based on new guidance, and we just want to iterate that the school will continue to operate on its current instructional environment until the metrics for the next instructional environment are met. And then I'm going to get to those 3 instructional environments. So instructional environment 1 looks like this. That's a 100% virtual instruction with the option to work from home for our licensed faculty with approval from a supervisor. There's only 3 indicators really on this one, and all 3 of these will be met. And as long as that's going on, we're going to be in 100% virtual instruction. So indicator 1, cases per 100,000 over 14 days. If it's greater than 200 and increasing or staying constant. Indicator 2 is our positive test rate. So as long as it's greater than 10% and increasing or staying constant. And that 3rd indicator, teacher vaccines, that school staff have not had the ability to be fully vaccinated. While that is the environment we're operating within, we are going to be 100% virtual. Our second instructional environment 2, is identified special populations attending in person. And when this happens, all of our employees will be reporting back to work. There are 4 indicators here. 3 of these 4 indicators will need to be met for us to move to this plan. So our cases per 100,000 will have to be less than or equal to 200 and decreasing. Our positive test rate will be less than or equal to 10% and decreasing. We need to be able to safely implement 3 to 4 of those strategies, and that puts us in that moderate level. And all school staff have had the opportunity to be fully vaccinated. So 3 of those 4 things will need to happen for us to be able to come back, start bringing those special populations back to attending in-person instruction. Our third learning environment is students attending in that orange and blue cohort, so operating in that hybrid model that we were in just as we left for winter break. Again, all employees will be reporting to work during this one. Again, 3 of the 4 indicators have to be met. Our cases per 100,000 will need to be less than or equal to 50. Our percentage of positive tests will have to be 8% or less. We will need to be able to safely implement the 3 to 4 of those strategies on a consistent basis. And then all school staff have had the opportunity to be fully vaccinated. So 3 of 4 of those have to be met for us to bring our students back into our building. So a few points to make about those 3 plans. We are not going to make instantaneous decisions. So we'll evaluate those trends weekly. The Buncombe County Health Department we have consulted with and will be verifying for us our trends that we're observing to make sure that they are accurate. Once we have confirmed that, then we will communicate the transition in a timely manner, and there'll be a plan in place to reduce chaos for teachers and students as we transition between plans. So there'll be no that the data changes on Monday and that on Tuesday we've changed our school plan. You can expect us to start communicating a timeline of how we'll transfer between plans and what that will look like. While operating in all 3 of these plans, the school is going to work to create opportunities on a voluntary basis. So even in the current plan, on a voluntary basis, we're going to try to get some students into our building to do their virtual work from the building. Athletics will be offered as long as we have staff willing to offer them. We will very likely have academic and social emotional interventions happening in person, and we are going to work hard to create some optional social opportunities. We heard you loud and clear regarding the need for those, so we are going to work to create all of that no matter which learning environment we're operating in. We want to make sure everyone knows that EC services will not be disrupted regardless of our learning environment. Specific in-person EC opportunities will be provided on a case-by-case basis per the student's IEP. We want to also reiterate this. All learning environment decisions are subject to change based on directives from the state of North Carolina. We're a public school. Those are not optional for us. All of our learning environment decisions, we're going to follow those metrics, but they are also subject to change based on adequate staffing needs being met. And then we want to make sure that everyone hears this loud and clear. All state and federally mandated testing is required to be administered in person. That is not an IC Imagine decision. That is a College Board and State of North Carolina decision. Students that are in those tested grade levels or courses are going to have to report to the school to take those tests. That's going to include the ACT that's coming for juniors in February and all end of grade and end of course testing. Not an IC Imagine decision that is mandated by the state of North Carolina and the College Board. So to summarize for you all, IC Imagine is going to continue to operate in Learning Environment 1 until the metrics indicate moving to Learning Environment 2. Again, there'll be a transition plan that's put in place once we've confirmed that's what's happened. We are going to use the feedback that you shared in the listening sessions to improve the 100% virtual experience for students and families. And we are committed to getting our most vulnerable students in the building as long as teachers and families are willing to participate. So we'll continue to prioritize the safety of all involved as we make those plans. And finally, I just want to come back around to you and say what I said when I started this. We are a community, all 1,230 students, 137 employees, and everyone's families. And to me, community means that we come together and we hold each other up when things are difficult, and we celebrate together when things are great. And right now, I think we're in a space of holding each other up and remembering that the safety and health of everyone has to be the number one thing that we consider. We tried very hard as we considered everyone's feedback to balance the physical health of everyone during COVID-19 with the mental health of everyone concerned. We hope that we have created a plan that creates that safe environment for everyone, but also provides that mental health piece and that gets our students back into school as soon as it's safe to do so. We do we do know that things might change. We might get new guidance, and we may be coming back to you again. And if that happens, we'll try to communicate quickly and clearly with you about what those changes are. In the meantime, we're grateful for every single one of you. We're grateful for the grace that you have shown us throughout COVID-19 and always. And we hope to see you back in person soon.